when it got started, I was just told, nobody wants to do ethics. Can you just lecture on ethics? And I've been doing that for more than a decade. And so ethics in end-of-life care and communication in end-of-life care. Another topic I was told to give. Of course, the reason why nobody wants these kinds of topics is because, it's not very clinical. It's not very biomedical. Anyway, I've been doing this for quite some time. And during that time, I've seen another reason why nobody wants to do it. Because a lot of people feel they're not that important, or they're not as important as the biomedical stuff. You talk about vaccines, how they make the vaccines, how it works, and then you see all these fancy diagrams and you see science, And during our time, it's already beyond half. More than half of the students are going into medicine thinking it's all about the science and stuff. A smaller minority would go into medicine thinking about healing and curing and caring, things like that. Of course, it depends on what medicine looked like while you were growing up. If you have a doctor, family member, or parents who are doctors, then you'll be influenced your preconceived ideas of what doctors are or what medicine is all about to be influenced by them. It's also influenced by the things you watch on TV. You see all sorts of things. Ethics at the end of life and communication at the end of life. I'm going to deviate from the current trend. It's been brewing for the past 60 to 80 years. The current trend is to teach you the rules. If you want to treat this disease, you do this, get this information. We don't care how you ask it, how you get it, just get it. The book doesn't even mention how you ask it, just get the information, think about it, and remember all the lectures about how to diagnose and how to make differential diagnosis. Think about the tests that you need, and then go back to the patients if you really need to and tell them what you're going to do. It doesn't matter how you disclose your ideas or how you disclose your diagnosis or how you disclose your concerns or your differential diagnosis. Say it if it's really needed. If you need some consent or if they're going to pay for the test or just to make it look like you're doing something. And that's pretty much the end of it. Rule-based protocol for communication. If you want to communicate this, do this. Step 1, 2, 3, 4, 5. And unfortunately, the way we test that, we might do OSCE, and the OSCE is very, we have to break it down into objective elements that we can check on our checklist. So step 1, sat down, introduced the name, did this, that, check. Step 2, ask if the patient already knows anything or figure out what the patient already knows. Even if you just ask 1 or 2 questions, it's just a check. So that's procedural. And then you graduate, and depending on the field you're in, every now and then, or if your specialty field exposes you to more of it, you'll see very sick patients worried about what will happen to them. Either debilitated, they'll be disabled, and maybe they're debilitated right now, they might even die, or they are dying. And suddenly, step 1, step 2 doesn't work anymore. Why? Because no simple approach or no simple list of steps and list of things to say and list of questions to ask will make up for the complexity of the situation. Each and every individual would react to the situation very differently. Even if you have 2 similar individuals in terms of temperament and personality and emotionality, they're exposed to a different set of family members, they're exposed to a different set of environment, and they would probably react differently. So you can't keep on repeating the same thing over and over again. You're talking to a real person reacting to a very difficult situation. And that's what communication is all about. Imagine your mom is feeling bad. She lost her job and you're trying to make her feel better. She has cancer, which might be curable. She's feeling really bad. Would you sit down and just do the step 1, 2, 3 approach? She will say something and you don't just go on to the next step. She says something more, you might stop your protocol and handle that issue first, right? So, and that's how I want you to look at protocols. This is a different way of looking at it. And this is very unusual because usually the way I see how things are going right now, it will just make you swallow all sorts of procedures and protocols and practice guidelines and just follow it without thinking. Hopefully it's not happening too much, but I know there's a difference between 10 years ago and now. You're supposed to think. That's what college is all about. College is not supposed to turning into automatons, like, good factory workers or good hospital workers. A good worker doesn't need to question the rules or doesn't need to improve on the rules. You just look at the rules, follow the rules, understand it, and if a new rule comes down from above, you understand what it is and you just follow it, right? I don't think it's a very good idea. 80 years ago, there were still traces of critical thinking. This is the problem, this is the goal, and as far as we know right now, this is the best way to do it. But we hope that you'll come up with better ways after you graduate. That's the idea. That's why you have to be good critical thinkers. Same with communication. This is the goal, this is the general idea. We don't want them getting stressed, but we want them to understand it completely. We don't want to do anything that's considered unethical by the community or the country or the society. And we thought about it, and the best way to communicate something that's simple and concise and easy to understand, and this is what we came up with. But I hope that you don't spend the rest of your 40 to 50 years in practice just doing the same thing over and over. I hope that you constantly think about it and come up with better ways, come up with newer and more efficient or better and more humane protocols, right? So that's the way I present topics. Once you start looking at patients when you're clerks and your interns, how do you approach it? Well, you just follow the rules. And actually, you can do that because nobody pays attention to it. The residents don't pay attention to it. Even the consultants usually don't pay attention to it. They just ask, did you get the information? And that's it. It doesn't matter how you treated the patient. You can even probably torture the patient to get the information out and nobody will care. That's exaggeration. But you can do all sorts of things and nobody will care, right? So the rule-based approach. Of course, there's little tiny sentences in the paragraph that you have to be compassionate, caring, and things like that. But, that's 80% of the thing. Every time it's written out, it's all about just saying the thing as sample questions and getting the information, and we move on to the next case. Or some would say, well, do only as much as everyone else is doing. That's even worse. You might not even follow the rules, especially in certain countries or communities where there's a sense of lawlessness. Like, the rules are there, but nobody really follows it. And if you can get away with it, then that's, just do it. And the easiest way with the least effort possible, right? So that you can get off work and enjoy your life. That's even worse. Nobody's following the rules, and the rules are cumbersome. And you can get away with just doing this, and why should I do anything different? Now, the third one would be, which is what I hope most of you would say, is this is what we're trying to do, and this is a real person in front of me. This could have been my mom. This could be me several decades from now. I'm not going to treat this person in the way I don't want to be treated myself. I'm going to treat this person in the way I would want my future doctor to treat me. That's not right. There's something wrong with that. It's malevolent or that's not good. Okay, so what's that? Ethics. Okay, so that's ethics. So both ethics and communication, I present it differently. And that's why I have to give you this short orientation, because I want you to approach these two topics or two sessions this way. Pay attention to the topics, and reading materials are there to help you understand. And these lectures, whether it's face-to-face or pre-recorded, and other supplemental videos which I make, supplement the readings, which supplement your own study about the topic. And ideally, especially for graduate studies, for graduate students, for soon-to-be doctors, you should be looking at other materials and get a good grasp of the topic. That's the way to go. So first and foremost, the topic, and do everything that you can to understand it. You definitely not restricted to my lectures or pre-recorded sessions or supplemental videos which I would make. And of course, the test will probably come from the reading assignments just to make things uniform. But after you graduate or while you're residents and nobody really talks about ethics and communication anymore, still keep ethics and communication in mind. And every time you interact with a patient during your quiet time, think about your entire day and think about how the discussion went or how you communicated your behavior. Think ethics, think morality, the most compassionate, the most caring way you can communicate and help this person out. Ultimately, that's what being a doctor is. That's the way I'd want you to approach these two topics. They're very important. They're treated as if they're not that important, but hopefully your group or some of you would form the small subset who would grow up and practice as if they're important. And I think they're really important. Okay? So if you talk to their residents or the older ones who went through the sessions with me pre-COVID, they'll tell you the actual face-to-face sessions might last 2 to 2.5 hours. Of course, I tried to shorten it. And then the question is, how was I able to shorten things to 40 minutes? Well, the things I took out would be, I was giving examples using cases, because it's easier to understand communication and ethics if I give you narratives of cases and show you how it really works in the real world. I had to take them out, especially with communication. Communication is very interesting because what I actually did is I presented the videos of cases. After I watch the video, I comment on the video using different perspectives along the lines of communication and ethics. I think those things are very important, but they won't fit a shortened 30 to 40 minute session. So what I did was I also made recordings of those. And for those of you who are wondering what's the next most important recording, if you want some more, and those are it. You'll easily find them because they're part of the communication playlist. Again, I made it optional. You don't really need to watch it, but I encourage you to do so. The only thing that's probably, they're still optional as far as I'm concerned, but the only thing that you really need to listen to, if you're supposed to listen to something, would be the lectures. Okay? And the lectures would run anywhere between 30 to 40 minutes, and they come in different versions, and just take one version and then go through your readings and go through your self-study. That's what doctors do, and in a few years' time you'll be doctors yourself. I actually treat you like doctors. So self-study, self-learning, that's the way to go. Don't just remember this and do it for the rest of your life. Please don't do that. So good luck and happy learning. And stay safe.